Hi, I'm Dr. Jan, owner of Chrysalis Chiropractic in Mankato, Minnesota, here helping you transform your life. If you are at a job or just sitting for any length of time, sometimes you can develop a low back pain because of muscle imbalance. And there's a specific muscle called the iliopsoas that is attached to the front of your leg, right about here. And then it wraps up and attaches to the lower part of your spine. So when you are sitting, because the leg is bent upward, that muscle shortens. When your leg is straight, it lengthens, and when your leg is bent, it shortens. So as that muscle is short and you're sitting for a long period of time, once you go to stand up, that muscle wants to stay short. So what you can do is you can do some stretches, which I'll show you later, but that muscle will be pulling then on your low back, and I'll show you here on the spine. The muscle wraps up from the bone on your leg, and it wraps up, and then it attaches to the vertebrae in the lower part of your back. And what that can do then, because it's pulling forward, it can create a little bit more tension in the spine because it is pulling that spine forward. And because it has that curve already, it's just going to pull it even farther. And we don't want an angle that is too much in the low back because that can cause irritation. So in order to stretch this muscle, because it's attached here and to your spine, you will want to be in a position like this. Now, of course, if you're having trouble with your knees or anything, please don't be getting on your knees. So you want to have some stability to make sure that you're not tipping over as well. And you want to make sure that the other foot is a little bit farther forward than your knee because you're going to be moving forward, and you don't want that knee to go too far past the toes, or actually you don't want it to pass the toes at all. So you're going to be on the knee, and then you're going to make sure that you keep your spine straight, and then you're just going to lean forward. And then that should put a stretch in there. Now, if you're not feeling a stretch in here, what you can do is reach over and to the side, and then you should feel a stretch in that muscle and on the front here. Try these stretches at least twice a day, and if you find that they're not helping, you may want to consider whether it is a structural issue that is causing your pain. So seeing someone like a chiropractor, your medical doctor, or a physical therapist may be in order.